Well, people often ask, why would I go away for 28 days or 45 days to do some of this work? And I think one of the first things is I have the ability to, when I go to treatment here, to leave work behind, leave bills behind, leave technology behind for the most part, and leave family where they are to give them a chance to heal. And I come to a place where it's in the mountains, there's rivers, there's trees, there's wildlife, and that just allows my nervous system to just start to slow down. And I can disconnect from the chaotic life that I've been living often and focus on getting well. And rarely do any of us have that opportunity. We're working here, trying to do this or that. And so being able to have that opportunity helps the brain to get in a situation where they can heal. Now, the key is they've got to learn, and we've got to help people learn how to take some of this home with them. Obviously, when they get home, they're going to have to work 40, 50 hours a week, and there's bills to pay and family to take care of and other responsibilities. So we don't want them to shirk that by any means. But if they can learn to take just some time for them every day, then they can get healthier. And the practice of mindfulness is a growing field, becoming very popular throughout mental health and other disciplines. And mindfulness is just that practice of checking in with myself and taking time to just be. And Dan Siegel again talks about what he refers to as the mind platter. And the mind platter is a handful of things that he cites for people to do in order to have a healthy brain. And one of the things he cites is time in every day. And time in is just reflection time into my mind and into my body, identifying what it is that's going on and what I'm experiencing, and just putting a label on it. He suggests another practice as part of that mind platter, which is downtime, where I just take a few minutes and I don't think about anything else. I'm not thinking about work. I'm just being present where I am and just allowing my mind to rest, which really doesn't happen a lot. And we can kind of do a map of what got people here in recent days or years or months, and rarely were they adequately taking adequate care of themselves. And in the setting there's a few lakes that we go to, some nice hikes that we go on, and during the summer months, we'll provide therapy out in that nature setting on one day a week, normally Friday, to just allow them to do some of their homework that they're doing, but also provide some psychotherapy in a private area out there. And there aren't many places that one can go to and have that experience.